Hello guys, in this video we are going to discuss about the cardiac anatomy and its surface landmark. So it is very important and it is commonly seen that in MCQs they never ask you the direct question about the cardiac anatomy. They always ask you about its relationship between the thorax and the orientation of the cardiac major muscle, major tissue or major muscles, which is oriented when we see in plain X-ray or cardioradiography. So why it is important to understand this cardiac anatomy and the surface landmark? It will help you in your clinical practice also, as the cardiac physiology and the anatomy are the prime importance when we took a round in our hospital setup. So to understand the cardiac anatomy, we have to first understand the surface landmark, and the first important landmark is the both the clavicular area. Now it is very interesting to know that heart is never lie on the left side. It is oriented on the center of the thorax, but its apex is pointed toward the left side. So that word I just use is the apex, and on the superior aspect it is called its base, where the major blood vessels enter or exit through the cardiac chambers. So first we have a clavicular area. Now in the clavicular area, if I point it out the middle of that, we create a line called the mid-clavicular line, which just pass not over the apex of the heart, but just parallel to the apex of the heart. It never crosses that point. So if it pointed, it's create a juxtaposition of the heart tissue, which is not the scope of this class, but again I'm going to discuss in the further batches. So the first aspect is the first clavicular space, and this is the first rib. Below it is we have a second rib, again third rib, fourth rib, and the fifth rib. So right now we have the important landmark of the 5 ribs. Between the first rib and the second rib, we have the first rib space, which is called the intercostal space. Again, between the second and the third is termed as a second intercostal space. Between the third and the fourth, the third intercostal space, fourth and the fifth is the fourth intercostal space, and between the fifth and the sixth is the sixth intercostal space. Now, the base of the heart is located at the superior aspect, and it is important to know that the base lie between the second and the third rib, or the second and the third intercostal space. It is a prime landmark of that. And secondly, it is just behind your sternum. So when you are going to auscultate, you are going to auscultate just above the sternum, but that is not a correct position for the auscultation because it gives the pseudo heart sound. I'm going to be teaching you how to take the heart sounds, but right now just understand that the superior aspect is the base of the heart, which is located between the second and the third rib. Now if I draw the sternum just above the heart, and I am going to start palpating from the superior to inferior aspect, I'm going to find a bump here, which is located into majorly occupies the 1/3 and the 2/3, in between the 1/3 and the 2/3 of the sternal body. So this bump is called the angle of Lewis. Very, very important landmark for the auscultation purposes. Now this angle of Lewis is also called as a point where the bone is going to be detached, like the two bones are going to be connected. In the mandibular area, both the clavicles are going to be attached, whereas more of the sternal area, major of your rib body attached to that point of area. Secondly, we have the right atrium. We again have a right and the left atrium. If we talk about the right and the left atrium, and I'm going to draw a heart like this. This is the right atrium, this is the left atrium, this is the right ventricle, this is the left ventricle. So the right atrium is going to be occupied your second intercostal space, just behind the angle of Lewis, which I just discussed about right now. And from that particular area of the angle of Lewis, if I go on the right side, if I go on the right side of that angle of Lewis, it is termed as the right aortic area. And toward the left side, it is called the left pulmonary area. So what is the importance of this right aortic and the left pulmonary area? Is it basically for the auscultation or considering the heart sound? So when you are going to auscultate on the right aortic area, you are majorly listening to the aortic sound in the either ventricular aortical ejection or relaxation or contraction. Same with the pulmonic area, but for the pulmonic veins and arteries. Now consider the fact that heart is rotated in the sagittal plane. It is not straight, which is as described in this figure. It is pointed toward on the sagittal plane, and that is why your right ventricle overshadow your the left ventricle. Means when you see in the chest x-ray, you find the tipping or the major portion of the right ventricular above your left ventricular, and the major anterior aspect is again formed by the right ventricular. So these are the important landmark which is going to be asked you in your MCQ. First and the major one is, at what level did the apex of heart lies? At what level did you find angle of Lewis, and at what level your right ventricular lies in relation to thorax? So this is the major important which is going to be asked in your question, and you have to take precaution while dealing with this type of question.